Exactly this. You interview experts, so I think you're the perfect person to chat with, and I thank you so much for coming on.
Thanks for having me.
Before we get into the kind of conversation, and you guys can feel free to add in the comments any questions that you have. We'll be able to see them in real time here and answer them. Before that, though, I want to play the story that aired last night so that if you haven't seen it yet, you get a little bit of context for this conversation we're about to have. So, James, are we able to play that? All right, here you go. What suddenly turned this happy, bright young girl
Have everything I want.
into someone her own loving parents were afraid of?
It's almost like a caged animal.
Danae and Chris Macklin say the sudden shift in their daughter Michaela began in 2015 after she was prescribed medication for a cough. After that, they say their sweet, quiet girl changed overnight.
The majority of the time, she was in a rage, scared, throwing couch cushions, screaming.
Even worse, there was seemingly no explanation. So many doctor's appointments and emergency hospital stays, and still no diagnosis.
You're scared, you're extremely hurt and frustrated, and no one can give you an answer.
Until February of this year, when Danae read a Facebook post about PANDAS. PANDAS, or Pediatric Acute-onset Neuropsychiatric syndrome, is a newly discovered condition defined by a sudden and severe change in a child's behavior, likely triggered by an infection. Michaela was recently officially diagnosed with PANDAS. Researchers now estimate that at least 1 in 200 children in the U.S. alone may have it too, and there's no known cure. This next part is something that Michaela's parents want you to see. This is Michaela falling into a PANDAS episode in the middle of our interview.
Pass out a little bit.
For the Macklin family, the worst of it isn't the $25,000 in medical bills because most PANDAS treatments aren't covered by insurance. It's not even the fact that it took so long to find answers. No, the worst of it is their little princess.
She'll see scratches on my arm or hand. Daddy, did I do that to you? I'm like, yes, baby.
She is hurting.
And you have to reassure her all the time, baby. There's nothing you can do to your daddy or your mommy that will ever stop us from loving you.
For now, the Macklins are focused on getting through each day. And raising awareness.
She is hurting. There are other kids out there hurting because no one wants to listen to them other than their parents and a select few doctors.
And praying their happy little girl, who is in there somewhere,
You have an awesome time today? Yes.
comes back for good someday. To learn more about Michaela's story, about PANDAS, and about PANDAS, which is essentially PANDAS linked to the strep infection, head to WCNC.com. Reporting for NBC Charlotte, I'm Savannah Levins. I'll send it back to you. Okay, guys, so that was the story that we aired here on NBC Charlotte, and obviously for a lot of people who had never heard of PANDAS or PANDAS, that was pretty shocking. For people who have heard of it and maybe are dealing with it in their own families, they had some feedback too, because obviously this is just one story. This was one family's story. There are so many different ways that symptoms can present. And so that's why I'm so glad you were able to join us today. And we're already getting some questions in on Facebook Live. If you guys have any, please add them. We'll get to them. I want to start by asking, what do you think maybe wasn't addressed in that story that everyone just saw that people still should know?
Well, it's absolutely impossible to capture the full scope of this disease in 3 minutes. I think actually you did a great job.
Thank you.
I think what people need to understand, first of all, is that this is a true medical condition. It is a neurological disease. And I think often when we see shots of 30 or 60 seconds of coverage of a child screaming, well, that could be anything, right? I mean, kids throw themselves on the ground all the time and scream when they don't get a piece of candy or their way. And that's really not what's going on in PANDAS. So I think really understanding the disease is truly a neurological disorder where the child's own immune system is attacking the brain. That's a really quick way to understand it. There's a lot of confusion around what's PANS, what's PANDAS, what's autoimmune encephalitis. Really, these diseases are all under the umbrella of autoimmune encephalitis, and that simply means the immune system attacks the brain. PANDAS is an acronym that was created about 10 years ago that stands for Pediatric Acute-onset Neuropsychiatric disorder associated with strep, where strep is the thing that kicks off the autoimmunity. PANS is where anything else kicks off the autoimmunity. But as you can see, any disease can kick off this series of events that creates this neurological disorder. What we saw in the footage that was just played is someone actually having a seizure, and the basal ganglia midbrain is where most of the antibodies that are involved in this disorder target.
And Michaela, the girl in the story there, I spoke with her parents, and her symptoms were all across the board.
Sure.
I mean, they said obviously a big one of her symptoms was rage. She would go into, these episodes of rage. Other times, she said, their parents said she would forget their names, or like completely black out and come to a few days later and not know what happened. Obviously, the seizures that you saw, in the middle of our interview, she went into seizures and then just fell asleep and then came out of it. It's so many different symptoms. So this was one story. We want to talk about other potential symptoms.
Yeah.
That was a huge question I got. And I think we have an infographic, James, if we could pull that up that you're seeing on your screen right now that might have a little information. Let me ask you, JC, what are some of the symptoms that might, mean PANS or PANDAS?
Sure. So I think it's important to understand this is really a disease that falls along a spectrum, like lots of diseases. I use the analogy, one might have a mole that's cancerous, that's cancer, or one might have stage 4 breast cancer, that's also called cancer. So this disease has different degrees of severity. So children can present with anxiety, with OCD, so that may look like starting to wash hands or hoarding, or even tugging on their hair or creating rituals, tics, school refusal. So this is one that really confuses people because, Johnny just doesn't want to go to school. Well, what's actually happening with these children is they're terrified. Imagine going to work one day, standing up to do your job, and your brain doesn't function properly. Imagine how anxious that would make you feel. That's how these kids feel when they go to school, when their brain is vacillating, like in Michaela's footage. Going to school and being away from mom or dad is terrifying. Urinary frequency, so actually having accidents or feeling like you need to use the bathroom when really you do not. A child starts wetting the bed when before they were not wetting the bed. That's something that we see in PANDAS. Strep symptoms such as skin peeling of the hands and feet, having what some people might call a diaper rash, but in an older child can often be strep in the diaper area. Changes in handwriting, steep declines in cognition. So a child who knows their addition and multiplication tables suddenly forgets them. Speech problems, so problems really expressing and putting together sentences where the child spoke well before. I could go on, and I think that's what causes some confusion, is that there are many different presentations. If you look on the National Institute of Mental Health's website, they will talk about abrupt onset of OCD and tics. You need to have one of those along with other symptoms to meet diagnostic criteria.
And I want to get to, I think we're starting to get some questions in here. One says from Julie, is the diagnosis based on symptoms or medical testing?
Yes, great question. So this is where the confusion lies. This is a clinical diagnosis, and this is the case with many diseases. MS, for example, lupus, diagnosed based on symptoms. So that is one of the reasons why there's controversy around the disease. Insurance coverage is an issue because there is no black or white yes/no test that one can get to say, yes, you've got autoimmune encephalitis, PANDAS. Now, folks go in sometimes to their doctor suspecting PANDAS, and they get swabbed for strep, and they're negative. Oh, I don't have PANDAS. That's not a way to rule out PANDAS. You have to look at the full picture of the child, all signs and symptoms, and not having a symptom of strep or a history of strep doesn't rule it out, if that makes sense.
Yeah. And I also, that kind of goes into something else I wanted to mention was we kind of titled the story as this is something that's new. And I wanted to address that because it's not necessarily new.
Yeah.
But new in the sense that this is very under-researched, very underfunded.
Yeah.
You know, you mentioned insurance doesn't cover a lot of this. A lot of people had never heard of this before.
Right.
Where do you think that knowledge is lacking? And one of the big questions I also got was, why have I never heard of this? If 1 in 200 kids, potentially more, have this, how have I never heard of it?
Well, I think that answer is multifaceted. First of all, PANDAS was first described by Dr. Susan Sweeto, almost 13 years ago now. She actually ran a study at the National Institute of Mental Health on the disease. So it's certainly been out for a while. But I think the confusion lies in the fact that the symptoms look like other things or can be explained away. So if your child is suddenly refusing to go to school and displays anxiety and has a hoarding ritual, you can say, well, they're just anxious. Let's put them on medication for anxiety. I think, too, medicine always looks for a black, white, yes, no test. And because we do not have a test for this disease yet, it's very difficult to prove that your child has autoimmune encephalitis, PANDAS.
Yeah, totally. I'm going to see if we have any other questions on here. A few people saying that one woman, Megan, says her daughter was diagnosed in 2009, so it's certainly been around. Jean says, my grandson has this. He presents in facial and body tics. Tragic to watch. He's at his worst when stressed, overtired, ill with strep. People talking about the causes of this. Rarely diagnosed, misdiagnosed, not rare. That certainly, seems to be a theme. Other questions I have, a lot of the symptoms that we're listing off seem like they could independently be just that, anxiety or not wanting to go to school or a rash. When should parents be concerned? When should they maybe bring this up to their doctor?
Yeah. So I will say I would look at the full picture of your child. I would review the symptom list that's on the National Institute of Mental Health's website, and I would see if your child has more than one symptom. And then a simple discussion with a pediatrician and asking them to try antibiotics and or steroids. That is really the first course of treatment. It's a pretty well-tolerated, low-risk treatment. Putting somebody on antibiotics for a week or so is really where parents would start. But looking again at that full picture, if your child has anxiety, do they also have, they've all of a sudden started wetting the bed at night? Mm-hmm. You can start to really put the picture together when you look at the list of symptoms.
Mm-hmm, definitely. Is there a cure? Can we talk about that? That was another question I got a lot. What are the treatments? You mentioned that a little bit, but is there a cure?
Yeah. So as far as treatments go, you're really addressing modulating or suppressing the immune system. So one of the main treatments that's used is IVIG, intravenous immunoglobulin therapy. That modulates the immune system to tell it, get back in line, stop self-attacking. However, it has to be usually given over and over again, and it's costly, not covered by insurance. Typically, it runs $15,000 a treatment. Most people can't afford to pay out of pocket for that.
Yeah, no kidding.
Yeah. Secondly, suppressing the immune system. So my child, for example, received 5 rounds of chemotherapy, a drug called Rituxan, that suppressed her immune system and took away all of her symptoms. Now, the good news is that most children, if treated pre-puberty, will outgrow this at puberty because the immune system goes through a pretty significant maturation at puberty, allowing them to recover from the disease. But again, the key is treating and diagnosing the child early. And that's why it's really important that we educate the community and physicians about this disease.
And in doing my research before this story and reading all the feedback I got afterwards and learning more after it aired, it seems like not everyone believes that this is real, Right. And so can you talk about that a little bit and the hurdle that can cause?
Sure.
And also, you say ask your doctors about it, but there are some doctors who maybe won't diagnose it. Can you talk about that challenge?
Sure. So, not believing that it's real, I've had conversations with physicians who treat PANDAS, and I ask them the opposite question: what makes you think it's real? Mm-hmm. And what they tell me is when you see a child recover from these neuropsychiatric symptoms that seem behavioral, maybe after a course of antibiotics or steroids, or after suppressing or modulating their immune system, there's no more convincing you. The change is so abrupt. Like we saw in the footage, this child's behavior and presentation, I shouldn't call it behavior, really symptoms are so different when she's treated that it's obvious. Mm-hmm. Now, if you go to your physician and you present them with information, and I would recommend that parents do print the information from the NIMH, very credible source, from their website, go in and talk about the symptoms the child is having, and if the physician is unwilling to accept it, it's time to find a new doctor.
Yeah. I was interviewing Michaela's parents for that story, and something that they said was, I just wish more people would have believed us about our own child. We knew that something was not right. That's and right. That it wasn't that she was just acting out, that something was really wrong.
That's right.
So would you encourage others to kind of take that proactive approach and say, look, this is my kid, I know my kid?
Yes. I think moms and dads know when there is something wrong with their child. And I would say keep searching until you find the answer. And that doesn't mean be in denial about what's going on with your child. Do some children have ADHD or just anxiety or just depression? And when I say just, meaning those things in isolation, of course those are real things. But if you see that things are more complicated than that, keep pushing until you find an answer that feels right. I know in our case, we saw several different physicians and had many tests before we were properly diagnosed.
I want to see if we have any other questions on here. Some people saying they've never heard of this. We talked about that. One person said, is this related to, do you know that word? I don't know that one right here that Greg asked. I don't think I know that.
Is it related to dysautonomia? So dysautonomia can be a symptom of PANDAS. It's really an inability for the body to regulate itself. It can deal with blood pressure. And yes, if you have brain inflammation, if you have an encephalitic process going on in your brain, you can experience dysautonomia. I would say you'd want to rule out autoimmune encephalitis PANDAS if you have a dysautonomia diagnosis.
Okay. Yep. Always trust your parental instincts. That's what. So Danae Macklin, the mother of Michaela in the story, is tuning in now. Another thing I want to ask. So obviously we're talking about causes. I think that was the biggest question I got. We mentioned it earlier. For those just tuning in, I'd like to touch on that again. Strep, obviously, I think is the most well-known one. The PANDAS, like strep caused my child to change, is the tagline on everything I read. What else could it be?
Yeah. So anything that triggers an immune response, which is a lot of things, can trigger PANDAS. So what we have to really dig deeper and find out what's going on with our children's immune systems. 1 in 200 kids have this disease. What are we doing to our children's immune system that make them susceptible to this malfunction? And boy, I think we could have a whole hour talking about that. Some people suggest vaccines or over-vaccinating, environmental toxins, our food, Roundup that we spray on our lawns. We could go on and on. But there's definitely something that's changing from our generation to the generation of our children that is making their immune systems less adaptable or more fragile. So it really isn't just strep. It's anything that can trigger an immune response from a child. So the flu, the cold, a vaccine, really anything can trigger this in a child. And just for the record, I think it's much more common than 1 in 200, but that's the statistics we have good data behind, and I think the one we should continue to quote until we have different data.
I gotta say, I don't have kids, but I can imagine for those who do, hearing that anything can cause it, and there's not really medical coverage for it, and that's stressful.
Yes.
What would you recommend that parents do if they want to arm themselves with more knowledge? Like, what are the best resources?
Sure. So, replace your fear with information. Go online and get a list of the symptoms and just know them in the back of your mind. And if you notice a symptom, go back and look at the list and make sure that there's really a couple that exist, because typically children will have at least 2 or 3 symptoms. Don't live in fear. As far as insurance coverage goes, there's a group of us who are working on legislation here in North Carolina to get all treatments for PANDAS covered by insurance. So we're pretty far down that road. Luckily, that work has been done not by myself, but by a great group of parents. So here in North Carolina, we've made good progress, and that's something that hopefully parents that come after us won't have to worry about.
And as a parent of 2 children who have this yourself, I'm sure you can speak to this. I'm sure this is so stressful for the families as well. Is there a resource to connect them together?
So I would say it's incredibly stressful on the family because of the disbelief. So if your child's diagnosed with a disease that people understand, like diabetes or cancer, what happens? People rally around you, they make you meals, they throw 5Ks. This is really an isolating disease, but it's just as severe. So I think it's important for parents to reach out. I have a podcast called Brain Inflamed. I'd love to point people to for information. I also have an Instagram account. Brain Inflamed Podcast is the Instagram. But there's also excellent resources. Aspire PANS is an excellent nonprofit organization. You can go on Facebook and join that group, or look on their website for additional information. Aspire PANS. Sorry, I said that really fast.
Okay, want to see, you're getting a lot of cheering in
that's
our
great.
comment section. Some people say, Dawn says, my son has PANDAS. We're still trying to find the right treatment. He suffers from tics. That reminds me, I got another question, which was, are there symptoms? There's a whole list of potential symptoms. Is there one or two or three that are most common?
Yes. So I would say a child needs to present with OCD and or a tic. And I would point people to the International OCD Foundation to learn more about how OCD presents in children, because it's very different than how it presents in adults. When you and I think of OCD, we might think of hand washing or being weird about germs, and certainly those are symptoms of OCD. But that organization does an excellent job of really spelling out what does it look like in a child. So a tic can look really like something a child can sort of hide. So an involuntary movement that repeats. Sometimes they're motor, like the one I just demonstrated. Sometimes they're verbal. You'll see eye blinking or eye rolling. Throat clearing is a very common tic. And children will try to hide or suppress them because they're embarrassed by them. And that confuses people. Wait, they can control this, then is it really real? Well, I would say it's akin to having a migraine when you're at work. You push through, you hold it together while you've got that bad headache. Then when you get home, what do? You crawl in bed and you let loose, because now you're in a safe place where you can rest from your migraine. Same goes with the tic disorder.
I want to see, I have a list that I'm seeing. We've gone through a lot of these. Who treats this in the Charlotte area? That was the question I got. A lot of people said that they've tried to bring this up to doctors and were either dismissed, or they can't find someone in our area who actually diagnoses this.
Yeah, so there's a couple physicians that are starting, actually for years have really tried to help families with PANDAS. Dr. Corbier is one that comes to mind. My personal pediatrician for my children is Dr. Anna Maria Temple. She's at Carolina's Integrative Health. I like her because she truly partners with moms and dads. She listens, and she looks at the root cause of all illness. So she approaches the child as a whole person, not just, here's a disease, let's link it to a medication.
Okay.
Yeah.
I'm going to see if we have any other questions on here. And again, if anyone watching has any questions, I'm here with JC. She is a parent advocate. You have a podcast about this very topic, PANS. How long have you had the podcast?
Only about a year now.
Okay.
Yeah. I do it as a hobby. It's just a way for me to get information out to a lot of people at one time. I was receiving a lot of calls and messages on Facebook, as you might imagine, and wanted to be able to respond to people in a timely fashion and wasn't able to. So going on to the podcast, I've got about 20 episodes now. You can listen to different topics that all relate to PANDAS.
Is it available everywhere people listen to podcasts?
Everywhere you listen to podcasts.
Great. Okay, check in the comments here. James, did you see anything pop up? One person, it looks like some people might just be tuning in. One person says, what is PANS? Could you just give a quick, for those just tuning in, what we're talking about here?
So PANS is Pediatric Autoimmune Neuropsychiatric Syndrome. PANDAS is Pediatric Autoimmune Neuropsychiatric Disorder associated with strep. It's such a mouthful. What these acronyms really mean is that a child has an autoimmune, self-attacking encephalitic process. So I like to use the term autoimmune encephalitis. And when you go to a specialist, there's several around the country, that is what they will diagnose your child with, autoimmune encephalitis. Really, if we could go back and change history, we would rename the disease just autoimmune encephalitis. PANDAS is really a confusing set of acronyms, I think.
And, the struggle I think we have with TV news is in a short period of time explaining something so complicated. In the most layman's terms you can, what would you describe this as, PANDAS?
So it's a misguided immune response. It's where the immune system is triggered by a normal thing, like strep or the flu, and then the body keeps creating antibodies, protective good guys, right, to that virus after the virus or bacteria is gone. And where do those antibodies go? They attack the brain. Typically, they attack midbrain and the basal ganglia. And if we look more into the basal ganglia, if people want to Google what the basal ganglia controls, you'll see that's why these symptoms present. So basal ganglia controls mood regulation, behavior regulation. The crying, laughing response we'll see dysfunctional in these children. I could go on and on. Swallowing. One of my children actually had trouble walking at one point. Seizure disorders, all again midbrain basal ganglia.
Wow. If anyone else has any questions, okay, it looks like someone spelled out the Dr. Corbier's name. Thank you for that. A lot of people reiterating that, and Dr. Temple as being local doctors who have worked with PANDAS patients before.
Yeah.
For those who might be concerned about this, is there hope for full recovery if a child has this?
Absolutely. I'm lucky enough to be in contact with thousands of different parents through Facebook groups and through my podcast, and there are many, many children who fully recover and go on to have absolutely normal lives after recovering from this disease. It is important that the disease is caught early and treated early, because you can imagine for a child, the longer their brain feels out of control and really is out of control, the more trauma the child incurs.
Scary, yeah.
It's scary to the child. And the more therapy they're going to need to retrain their brain to be able to function normally and feel normal in their own skin.
And a lot of the things I read, and I think one of the scariest things to me reading about it was that a lot of these symptoms just present overnight, was a word I saw a lot. It seems to just come on so suddenly.
That's right.
Would that be a sign to a parent that maybe this might be that?
I'm not a big fan of the overnight onset. That is what's typically described. But when I talk to parents who describe an overnight onset, when I dig deeper into their story, there's symptoms that presented, but in isolation. So symptoms that might have presented over the course of a couple years, and then one day it got so bad that, oh my gosh, there's something really wrong going on here. And that's what people will call the abrupt onset. But if you really hear the whole story, you can see that symptoms started developing slowly but surely.
But I can imagine that would be so hard for a parent to be able to tell. You think your child's just having these small issues that they'll get over, or, like you mentioned the tics, you might not even be able to tell,
So true.
Kids do stuff like that. So I can imagine that would be so difficult. If anyone else has any questions before we sign off, is there anything else that you can think of? I know, after this story aired, I got a lot of response from the PANDAS community.
Sure.
People wanted us to elaborate on a lot of these things, so I'm so glad we have. Was there any feedback you got about it that we didn't touch on already?
I just want to emphasize to people that are just learning about this disease is that it's truly a neurological disease, just like epilepsy, for example, and it's not in the child's control. It is not behavioral. The symptoms look like behavior, but they aren't true behavior because there isn't a choice being made on the child's part. There is an excellent medical conference that's actually coming up this weekend in Washington, D.C. It's affiliated with MedStar and Georgetown University Hospital. The topic is PANDAS. It's for medical providers on Saturday and for the general public on Sunday. So that's something people might want to take a look at. You can just Google PANDAS conference at Georgetown and find more information. It is a CME conference, so if you're a medical provider listening, you can go and receive continuing medical education.
Great. I think we touched on all the questions I had. A lot of people brought up Lyme infection, Lyme disease. Is there a correlation there? Why did I keep hearing that?
Yeah, so there's a lot of confusion and potentially even overlap with Lyme and even the autism community. PANDAS and PANS are different than Lyme disease. Certainly Lyme infectious agents can trigger a PANDAS-PANS type response, but Lyme really is a whole separate topic, in my opinion.
Okay, great. I'm going to see if we have any final questions. Can you post the first name of Dr. Temple and where they practice?
Yeah, so Anna Maria Temple is at Integrative Health of the Carolinas. Her practice is in Dilworth. Her name is Anna Maria Temple.
Okay, great.
Yeah.
And then we see Megan Steve says, my daughter is 18 now, freshman in college and thriving. She still takes meds to help with the OCD, but she's doing amazing. That
Awesome.
is so good for me to hear that, this is so stressful. I think learning about a lot of this, and maybe for parents who had never heard of this could be kind of like a stressful weight thinking that this exists. It's scary.
Yeah.
But to know that there is light, and options.
Absolutely. And hope.
Yeah.
And educating the community is just super important because a child who's caught at the very beginning of this illness, some can be treated with 1 or 2 courses of antibiotics, maybe a round of steroids, and they're better. So education, again, super important.
Mm-hmm. All right, I think, well, one more question. Does this only occur in children?
Controversial. So my opinion is no. I think if untreated, it can transfer into adulthood. The theory around it being a pediatric illness is that the blood-brain barrier really becomes a lot less permeable as one grows. And so therefore, antibodies that are going to attack the brain aren't able to cross over when someone is an adult. However, I have seen cases of PANDAS in adults, but I think they probably started when they were children.
Okay.
Yeah.
And again, just to kind of wrap things up and address, the story, if you're just tuning in, the story that we did that aired last night at 11 p.m. and again this morning on NBC Charlotte this morning about PANDAS. This was one story out of so many. Michaela, the little girl in the story that I did, her symptoms were her symptoms, and their family struggle was their family struggle, but there are so many different ones. So you're so right. Education is key. I'm so glad you were able to come in and chat with us. Danae said PTSD for the caregiver, yes, and I know Danae was helping me ask questions, and we did talk about that a little bit about how it can be tricky for the caregivers. I mean, any advice as a parent, yourself of two kids who have PANDAS, any information or advice?
So watching your child lose their normal abilities overnight is incredibly traumatic. And as we saw in the footage with Michaela, watching your child just seize all of a sudden or bang their head against a wall or fall on the ground and scream when you can't help them is incredibly traumatic. I really like a method of therapy called EMDR. Folks can just Google it. It's very effective in soldiers coming back from war to treat PTSD, and I think can be really helpful for parents. I have undergone that therapy myself, found it really helpful. I would also point folks to something called neurofeedback. It can help really calm the brain after years of traumatic exposure. But taking care of yourself when your child is also very sick is difficult. I would say get help and support when you can, and that's why it's so important that we educate the community, because like I said before, when your child has a known disease that everyone believes in, it's easy to get support. Our community tends to be somewhat isolated, and I would just encourage parents who are watching and listening, if your child has this, talk about it. It's nothing to be ashamed of. It's nothing you're choosing or they're choosing. It's a disease like any other.
Yeah. JC, thank you so much for coming on our Facebook Live to talk about this. Again, your podcast, Brain and Flame. People can find it anywhere, learn a lot more about this. There's only so much we can talk about in this Facebook Live, only so much I can fit into that story, unfortunately, but we do want to follow up on this. We want to answer all of these questions, so if anyone watching has more questions later on, please send them to me, post them in the comment section here, and we'll try to get to them. JC, thank you so much again for coming on.
Thank you for covering this topic. It's super important. I appreciate it.
Yeah, it's one of those things we talked about where it's just so tricky to cover. It was I've said this off camera, but I've covered a lot of really complicated issues, and this was something that's near impossible to wrap my brain around as someone who's just being introduced to this world and learning about it. So I appreciate you coming in and everyone who's been giving us feedback and encouraging us to talk about this. That's great. I love it.
I appreciate you taking the time to open up even a deeper conversation in doing this Facebook Live, so thanks.
Yes, thank you so much. And thank you guys for tuning in to Facebook Live. Again, if you have more questions, send them our way. And I'll be tuning off. Have a good day.
Birthday to you.
What suddenly turned this happy, bright young girl
I have everything I want.
into someone her own loving parents were afraid of?
It's almost like a caged animal.
Danae and Chris Macklin say the sudden shift in their daughter Michaela began in 2015 after she was prescribed medication for a cough. After that, they say their sweet, quiet girl changed overnight.
The majority of the time, she was in a rage, scared, throwing couch cushions, screaming.
Even worse, there was seemingly no explanation. So many doctor's appointments and emergency hospital stays, and still no diagnosis.
You're scared, you're extremely hurt and frustrated, and no one can give you an answer.
Until February of this year, when Danae read a Facebook post about PANDAS. PANDAS, or Pediatric Acute-onset Neuropsychiatric syndrome, is a newly discovered condition defined by a sudden and severe change in a child's behavior, likely triggered by an infection. Michaela was recently officially diagnosed with PANDAS. Researchers now estimate that at least 1 in 200 children in the U.S. alone may have it too, and there's no known cure. This next part is something that Michaela's parents want you to see. This is Michaela falling into a PANDAS episode in the middle of our interview.
Pass out a little bit.
For the Macklin family, the worst of it isn't the $25,000 in medical bills because most PANDAS treatments aren't covered by insurance. It's not even the fact that it took so long to find answers. No, the worst of it is their little princess.
She'll see scratches on my arm or hand. Daddy, did I do that to you? Like, yes, baby.
She is hurting.
And you have to reassure her all the time, baby. There's nothing you can do to your daddy or your mommy that will ever stop us from loving you.
For now, the Macklins are focused on getting through each day. And raising awareness.
She is hurting. There are other kids out there hurting because no one wants to listen to them other than their parents and a select few doctors.
And praying their happy little girl, who is in there somewhere,
You have an awesome time today?
comes back for good someday. To learn more about Michaela's story, about PANDAS, and about PANDAS, which is essentially PANS linked to the strep infection, head to WCNC.com. Reporting for NBC Charlotte, I'm Savannah Levins. I'll send it back to you.